It's time for Wise Money with Korhorn Financial Group with financial advisors Kevin Korhorn, Mike Bernard, and Josh Gregory.
Welcome to another episode of Wise Money with Korhorn Financial Group, where every week we're helping you take your next wise step in your financial life. My name's Mike Bernard, your host and one of the certified financial planners on the show. Across from me in the KFG studio, certified financial planner Kevin Korhorn.
Yeah, so how do you plan for healthcare and retirement? It's such a large expense, and one where the wrong decision can limit your financial freedom and financial choices in retirement. So today, we welcome back fan favorite Ted Foster to the program to discuss your options for healthcare and retirement and to help you figure out how to plan ahead for healthcare and retirement.
That's right. Did you know that the Wise Money Show is on YouTube? That's right. We've got a YouTube channel. You can check out every episode, this episode right now as well, and the full bank right there on YouTube. Just search Wise Money. We're on Facebook and Twitter as well. You can reach out to us there as well, Wise Money Radio. If you have a question, we would love to hear from you. In fact, today's show is launched off of actually several questions we've been getting from people about, hey, what are my options with healthcare and retirement, and how in the world do I plan for that? So you can reach out to us, give us a call, send us a text, 574-222-2000. That's 574-222-2000. You can find us online, wisemoneyradio.com. All right, so I was talking to some friends recently, and they said, hey, we're looking to retire next year. And I started talking to them about all these seemingly disconnected parts of their financial life that you actually need to tie together in order to determine if you're ready to retire. And as I was sharing that with them, their eyes got really big because they hadn't really heard that before, but they got it. And she interrupted me kind of as I was landing that plane, and she said, yeah, but what about health insurance and health care? That's such a big expense. You can't really plan for that, can you? And I just kind of chuckled and started sharing some of what I would consider the biggest financial choice, one of the biggest financial choices you've got to make in your entire life, and that's what to do with health insurance. And I started sharing some of the education that our own Ted Foster has educated me on in the past. And it was very helpful to them, and that's what we plan to do today on the Wise Money Show. So Ted Foster is joining us. Glad to be with you again, Ted. He is a health insurance expert on the KFG team. He's been doing health insurance nothing but for about 30-some years, so he's seen just about everything. No jokes there, Kevin. So we're glad to have him back on the show. He's
nothing funny about that, Mike.
He shared about Medicare with us in the past, but we're specifically going to talk about different scenarios and how to get ready and plan for health insurance and retirement. So, Ted, very first one, plain vanilla. Let's assume a couple is planning on retiring right at age 65. They're both born on the same day. They're both turning 65 the same day, and they're getting ready to retire at age 65. What are their options for health insurance?
Well, about 60 days in advance, they'll want to sign up for Medicare at the Social Security office. They can do it online, or they can go in and sign up. If they're drawing their Social Security income, then they will just hold the Part B cost out of their Social Security income. The standard rate for that is $134 per month this year. If they're not drawing Social Security income, then they will get billed on a quarterly basis. So it'll be $134 times 3, and they'll bill them every quarter for that, and that's per person. So then you get your Medicare, and you turn 65, and your coverage will start typically the first of the month of your birthday month. The exception to that is if you happen to be born on the first of the month, they start you a full month early. But other than that, it'll usually start in the first of the month of your birth. So you will need to have your Medicare A and B, and then you have decisions to make. You'll need to get either a Medicare Supplement and a prescription drug card to go along with that, which is called Medicare D. So you'd have A, B, D, and a Medicare Supplement. Or you would have A, B, and C. The C is a Medicare Advantage plan.
Don't let Ted's cool demeanor and smooth voice confuse you. He said that's a decision, and he said it kind of very, very lightly. That is an enormous decision. One where I don't know, Kevin and I even were just talking about this before the show, of people that bump up against that decision and haven't haven't thought through all the implications and don't understand it completely, and they just kind of make a choice, and believe it or not, a lot of it based on, well, what their friends are doing.
Right. People talk to each other and they say, "Hey, I've got this health insurance thing with Medicare, and I'm paying $130 a month for it," and that's also real close to what the Medicare B premium is. But they have a supplement, and their friend or their friends say, "Well, wait a minute, we're paying $29 or $19.95 a month. Why are you paying so much? You must have gotten a bad deal."
And because it's the same, we've talked about this before, Ted, because they've done a terrible job naming these things, you think, well, wait, my Medicare is costing $160 a month, and your Medicare is costing $20 a month. I'm getting ripped off here. There's and that I'm going to push back to Ted and then say, all right, so start explaining the difference to us, because one is traditional. I would call it traditional Medicare, A, B, D, and a supplement, and the other, yeah, you've got A and you're paying for B, but then it's Part C, and their cost and their coverage is very different. So can you share a little bit of those differences, maybe in cost and coverage, Ted, between the two?
Sure, I can try.
All right.
So a Medicare supplement, traditional supplement, and let's take the simple route first. Well, if you choose a Plan F, probably wouldn't recommend an F right now because they're going to stop issuing those in 2020, and I'm afraid what the rates will do, but they're easy to explain.
Okay.
So the copay or the deductible is zero. The supplement will pay the Part A deductible, it'll pay the Part B deductible, pay the 20% that Part B doesn't pay, and any excess costs. So you can easily manage how much am I going to have to pay at the doctor and if I go into the hospital.
Almost nothing.
Zero.
Yeah.
Yeah.
You're paying more in your premium, though.
Correct.
What's a typical? So you said so. Part A is at no additional cost. I usually say free, but we've been paying for it all along.
Absolutely.
So that's your hospital care. It's no additional cost. Yep. Part B is your doctor visits. That's $134 per person per month, as long as your income is below a certain level. Yep. Watch out for that surprise. That's why you need planning. And then Part D is how much?
The average is $34.
Okay.
So usually less, but the average is $34.
All right. So then,
And D is my drug.
D is that's the only one that makes sense. D for drug.
That's correct.
And then so the supplement, and this example, Plan F, which would really cover everything soup to nuts, is approximately how much?
At age 65, about $125.
Okay.
Somewhere in there.
Okay. So all in, you're looking at somewhere
About $265.
Yes, just below $300 a month per person. Okay. But then when you use the insurance, because you got the comprehensive supplement plan, there's really no out of pocket. You're paying that amount per month for premium, but really nothing else, not much else.
Not much else at all.
Okay. So contrast that to going the Advantage route.
Yeah. So a Medicare Advantage plan is you opt out of Medicare and you choose a plan directly from an insurance company. So much like we've done our entire life. We have a plan that's issued by one of the many companies that offer these. And the costs are, the premium, I'll say, not the cost, but the premium is significantly lower. There are plans out there that have a $0 premium. Mm-hmm. And so you say, well, that was $125 plus 34. This is zero. This is a better deal. And that's what you were saying, Kevin. It's just not a better deal. It's a different deal. You need to know exactly what am I looking at for cost? How am I going to manage these claims when they arrive? Because I'm going to owe people money.
Because when you use the insurance under an Advantage plan, you are going to pay copays. You're going to pay deductibles. There's going to be more cost as you use the insurance.
Much more cost. Most of those plans have an in-network out-of-pocket limit of about $6,000 and an in and out-of-network of about $10,000. Mm-hmm. Those vary company by company, but it's about like that. So you're going to go to the doctor, you're going to have a copay. You go to a specialist, you have a bigger copay. You go into the hospital for 3 or 4 days, you're going to pay $295 per day. Mm-hmm. Most of the plans are up to 6 days. So you'll have a fair amount of bills in The one thing I talk to people about always is this: the simplicity of how am I going to manage this thing as I retire. I'm retired. I've been sick. Now I've got a bunch of bills. how am I going to manage this? So that's an issue.
So plus another issue. So what should you do? How do you manage it as you get older? And then what if you retire before you turn age 65? What do you do there? So we've got a lot more to hit here coming up on Wise Money with Korhorn Financial Group. Oh, that was awesome. Sorry, I wasn't sure if you saw that
Yeah,
first
I was
wave.
on it.
I figured you were, but
But don't hesitate.
okay. Every retiree needs to listen to that 10-minute segment. I mean I don't know if it was perfectly clear, but we're going to come back to those options, recap, and then how do you decide?
We have to come back and talk more about the drug plan.
Okay.
See, yeah, well, I think not just that, but help, because to me, if I'm listening, and so remember the folks that listened to our Medicare, they watch the Medicare YouTube a couple of times because they're trying to get it because this stuff does not make sense.
Yeah.
And so,
They were confused?
yeah.
Yeah. Yeah.
And so we have to me, I would start this next section just breaking it down. A, B, D,
I will.
and supplement
Yeah.
versus A, B, C. And why would you pick one or the other?
Can we hit that first?
And what? And
I'll answer anything you ask.
yeah, to me, what's the risk? Is there a risk
Yeah.
to me picking one or the other? Because in absence of risk,
yeah.
I'm picking the cheapest one,
Yeah,
right?
Right. Okay.
I
Ah,
like that section
good.
enough that I can wrap that and we can put it on Facebook and such. Do you think it was? Do you
yeah.
think it was enough material there for it to be stand on its own?
I don't know. We let's do the normal show and we'll watch it and see, and we would do that after Zoho.
Yes. Yep. But I would love to hear Daniel rapping about Medicare.
Oops, who wouldn't?
Medicare.
That's funny. All right. Are you ready to make the most important, possibly the most important financial decision of your life when you turn age 65? Yes, I'm talking about that big choice on what to do with Medicare. They're not all built the same. We're sharing and contrasting the option that you have, and in just a moment, we're going to dive into Ted Foster's brain and say, how do you choose, and what are the risks? How can you make changes, and so on. So we are glad you're with us today. This is Wise Money with Korhorn Financial Group. My name's Mike Bernard. With me in the KFG studios, Kevin Korhorn. Between us, health insurance expert Ted Foster. Special thanks to the attorneys at Ledoux, Kern & Keene, as well as First State Bank for sponsoring the content of today's program. If you have any questions, we were just talking about, we've had Ted on the show talking about Medicare in the past, and it's confusing. It is confusing. What a shame that when we need simplicity as we're approaching retirement, that they've made this thing so darn complicated. So if you have questions, reach out to us. We'd love to help you. You can sit down and talk to Ted individually about your own situation. Reach out to us. You can do so. Call or text 574-222-2000. That's 574-222-2000. Or find us online, wisemoneyradio.com. You were going to say something, Kevin?
Well, I hate to be a distraction, but just you were talking about our sponsors and you were talking about Ledoux, Kern & Keene, and I had a client this past week who texted me and said, hey, I have an emergency. They were trying to get a mortgage on a big farm property, and there was a mortgage that hadn't been released from way back, and he said that I need an attorney to save my bacon this afternoon, and Mark Crinity just came through and was awesome. So the sponsor, we believe in and work with the sponsors on our program, and they are truly awesome.
Yeah, I am not surprised to hear that about Mark. That's wonderful. That's great.
Rave reviews for him.
Yeah, wonderful. Okay, let me recap what we've covered so far, and then we're going to get a little bit deeper. When you are turning 65 and making a decision about getting on Medicare, now if you're still working, we'll get to that there in a bit. But and are about to get on Medicare, you've got a big choice. Again, as I say, one of the biggest choices you'll make in your financial life. Do you go with traditional Medicare, which is Part A, Part B, Part D, and a supplement, or, and that's an enormous or with a big gap between them, Or do you go with Medicare Advantage, which is A and B, but then an Advantage plan that kind of where you opt out of Medicare and you've got a private insurance company. So there's a big cost difference. Traditional Medicare, you're going to pay probably somewhere just a little less than $300 a month per person for your premium. But Medicare Advantage, what would you say? It's probably something closer to $150 all in.
Yeah.
So it's almost half the cost. They're not built the same, though. So, Ted, how do you decide between going with traditional Medicare, A, B, D, and a supplement, or going with Medicare Advantage?
It's a personal preference. We have a lot of discussions. We talk about how long, how well you are, how you feel, what prescription drugs you take. We'll go through the cost and the ability to manage the claims. I have had more than one person come into my office that has a Medicare Advantage and drop a stack of paper about 2 inches thick and go, I cannot figure these bills out. I don't know who I owe this money to. I know I owe money, but I just can't figure it out. And it's a big job. And typically, or almost always, it's going to come after you've been sick. So you're not only aging, but you've been in a hospital and you've had treatment, or maybe you're still having treatments, and you have to manage all that. There are things I like about Medicare Advantage, though. It's one place for your health care, one place for your drugs. They do give you a Silver Sneakers membership, which I think is the worst reason in the world to buy a health plan. But nevertheless,
it helps.
And that has been a factor.
Yeah,
it is.
helps people make a decision.
And for those of you who don't know what a Silver Sneakers membership is,
What is that, Ted?
that's where you get access to some of the. I think you can go to Beacon with the Silver Sneakers.
Certain health clubs, right?
Yeah.
And
Many of them.
yeah.
You drive down the road and you'll see, we take Silver Sneakers. And so it's kind of a normal term. People will look at that and go, well, I want that because it's free. So there are some things about the Advantage plans I like. I like the low premium. If you're going to go that way, certainly choose a PPO plan. There are HMOs, there are PPOs, and I can't say one's bad or one's better, but you really need the access to more doctors as you get older and your health gets worse. And
It's just surprising me that they're still HMOs.
Right. So just in the spirit of being a jargon-free zone, just a quick handle that I could put on HMO and a quick handle I could put on a PPO.
Yeah. So on a PPO, it's a bigger group of doctors that you can see, and a bigger group of hospitals. In an HMO, it's not as much access. Medicare with a Medicare supplement is pretty easy to remember. We can go to any doctor anywhere in the country that bills Medicare.
Oh, that's simple.
They don't have to accept it if we have a Plan F or a G. Anybody that bills. So if you decide there's some specialist somewhere that you want to see that person, you can just go there.
Okay.
So,
And HMO is more restrictive. There's fewer people, and it's referral system too, right?
yeah, still referral system where
golly.
one doctor, theoretically manages your care and sends you out to other doctors for other things.
Okay, so you shared a little bit of the difference there. There are some positives about the Medicare Advantage, and I've got great friends who have selected Advantage. They're happy with them. However, it's cheaper in premium, but you're going to pay more when you use the insurance. Compare that to the traditional Medicare. And again, the confusing thing is when you're talking to your friends, these sound like the same thing. They're both sort of Medicare. It's just one costs more per month. There's a difference, though, in when you use it. So let me ask you this. I'm 65, I'm young and healthy, in my go-go years, I don't have any health issues. I'll take the Medicare Advantage, and then in 10 years, when I think my health, maybe I've had a health scare or two, at age 75 or close to 80, well, then I'll switch over to the more expensive one. Can I do that?
Don't we wish we could?
Yeah, it seems great.
It actually is the exact reverse of that.
Exactly.
You can purchase a Medicare Supplement or a Medicare Advantage at age 65. No medical questions at all. Just enroll. Later, if you want to go to a Medicare Advantage plan during open enrollment, so if you chose a Medicare Supplement and you want an Advantage plan, October 15th to December 7th each year, you can go to a Medicare Advantage plan, no questions asked. But if you chose a Medicare Advantage plan and you later want to go back to Medicare with a supplement, In most situations, you'll have to answer a series of medical questions.
So it's not I don't need homeowner's insurance because my house isn't on fire, but then you find out it's burning. Let me quick call my agent. No, you can't do that.
Cannot do that.
Well, once you realize you have a health insurance or a health issue, if you're on Medicare Advantage, you can't easily jump over to supplement.
So I can easily go from traditional Medicare A, B, D, and supplement over to Advantage, but it's basically, would you call it underwriting?
Underwriting.
So my bet is, if I'm managing risk and making a bet, think of your home and auto. If you have a high deductible, you are betting that you're not going to need your insurance. You'll take lower premiums over the long haul, betting that you're not going to need it, and you're not going to have insurance be your first dollar of coverage. And so versus having a low or no deductible plan, it's much more expensive, but with no deductible, I'm betting I'm going to have an accident and I'm going to need to use it. So you would say the traditional is, I'm betting I'm going to have health issues from the time I'm 65 as I get older, and having an Advantage, I'm betting that I'm not going to have health issues.
That's why I say this is one of the biggest financial decisions you've got to make, and you make it at 65. And I tell people, just assume you can't change your answer. Assume you've got to make a decision at 65 and just assume that you can't change that answer, because if you decide on Advantage and want to go to supplement, you've got to prove that you're healthy. And at any time, the government could also just say, no, we're not going to let you do that. They could change the rules, right? At any time?
They could change the rules. I doubt
I
don't see them changing that rule, but they could.
And I don't see a lot of people who are on supplement that later in life, once they start using their insurance, would switch over to Advantage, although that can't happen. That's why we're trying to educate you on what your options are. Okay, so there's a couple other things we need to hit with this specific decision. One is drug plan. I know Ted said we need to hit that, but then there's other scenarios. Some of you are thinking, I don't want to wait until 65 to retire, and I'm ready. I've done my planning. I want to retire sooner. What are my options with health insurance then? Also, what if I retire after 65? What do I do with health insurance? So a lot to hit here. Coming up on Wise Money with Korhorn Financial Group.
Boy, that time goes quick.
It does. This is good. That's perfect analogy. The analogy I was trying to show, I just didn't land, but yours, that was exact. Perfect.
So because
That's the bet.
okay, so here's what we have to do. We have to skim.
And then I get a couple spikes right after 8.
I just was like,
Nothing major.
So we have to just skim the waves, because, and Ted, this is the this is 3 shows worth of content. So could you? I mean, is it as simple as saying A? Because to me, instead of using alphabets, I'm saying I want to use letters and words. A is hospital, B is medical, D is drug.
B is doctor. Call it that, because hospital is medical. So B is doctor,
Okay.
C is Advantage, and D is the one that makes sense.
Yeah, and so C, but Advantage doesn't make sense. So C is HMO, PPO, high deductible.
Yeah, but that doesn't make sense.
Yeah, that's hard to.
Doesn't make sense.
There are rules.
That's jargon.
It's not just jargon. We can't just slam the Advantage because we.
No, I'm not. No, that is not at all slamming the Advantage. I'm saying, look, it's a risk management decision.
Yeah. But if you're skimming the waves, that gets into jargon. If I'm glad you asked, hey, what's the quick definition on PPO HMO? Most people when they hear that go,
Yeah.
well, actually they go.
And I didn't bother.
U93.
I didn't bother to say. I didn't bother to say PFFS because that's the other one. Nobody knows what that one is.
Yeah.
So, okay. So 2 important things. I want to talk about the drugs some more.
Yep.
Just a little bit. And then when we get to the retiring after 65, I want to mention the Honeywell Bendix thing.
Yes, that's why it's in there. That is why it's in there.
Well, and GE just went to basically the same thing.
More companies will.
And all companies will eventually.
My guess is we've got a full segment. This is third segment. My guess is we've got a full segment of cleaning up Part D and this initial choice, and then going to the retire early. That's going to be a full segment. And then it'll be the fourth segment where we clean that up and talk about retiring after 65. So, it's good. It's good stuff, though.
So, dude, somehow, at what point do we break out the 6 areas of financial planning and say the reason why we're talking about the reason why we basically dedicated a whole show to Medicare planning is it's part of protection planning. So there's a protection planning piece in here, but really it's your budget. So it's present financial position, but really there's some tax consequences. So you need to do tax planning.
You want to do that
Yeah,
right now when we open it?
Yeah, absolutely.
All right. Are we ready? Coming to you from the world headquarters of Korhorn Financial Group and the KFG studios, this is Wise Money with Korhorn Financial Group. My name is Mike Bernard. Across from me, Kevin Korhorn. Between us, health insurance expert Ted Foster. Thanks for being with us today. Also, thanks to Bethel College Adult and Graduate Studies, as well as Diane Bennett with REMAX 100. I know she's very busy right now, the housing market going the way it's going. We are talking about health insurance and this enormous decision that you need to make when you turn 65 or when you retire, wherever that lands, before 65 or after, and how it's a decision that you kind of can't go back on.
Absolutely.
And so let's encase that decision and really how it plays into your entire financial life, Kevin.
Sure. Well, if you're listening, you might say, how in the world could you dedicate a whole hour of the Wise Money show to Medicare and Medicare planning? And one of the things that
How boring.
actually inspired this is we were meeting with a client who'd heard about us from the radio show, and he said, hey, I watched the episode with Ted talking about Medicare, and I watched it twice to try and understand it. And it's incredibly complicated because you think your whole life you've had health insurance in some way, shape, or form a certain way, and then at 65, and I don't know about how you're feeling, but just think, the older I get, am I getting sharper or maybe not as sharp as I used to be? And so you get to a point where cognitively you may not be as sharp as you used to be, and you have to do it completely different. You used to do it one way for your whole life, and now at 65, a completely different way. So there's some deep thought that needs to go into this. There's an educational process, and it can be overwhelming. This is why, in our humble opinion, you want to work with a financial planner, because people say, why financial planner? And I say, if you're going to work with a financial planner, make sure you're working with one that is certified. Mm-hmm. So a certified financial planner is going to know a little about a whole lot of subjects. Mm-hmm. And so you say, where does this fit with Medicare? What is this? This is protection planning. There's 6 areas of financial planning. This ties right in to protection planning. It also ties into my budget. Fidelity's,
which is present financial position.
Your present financial position. Fidelity came out and said, hey, you're going to spend $280,000 in your retirement. Are they right or wrong? I don't know. Figure out if they're right or wrong for you. You want to know the answer, and how does that fit into your budget? There are tax consequences. If I have my last couple of years really high income, it's possible. We've been talking about $265 a month. It's possible I'm north of $500 a month per spouse if I have a liquidity event or some other things, mm-hmm. high income. So tax planning is a big deal, and retirement planning. So Medicare planning fits. And so if you're not getting towards 65 and getting ready to retire, if you're already retired and you're listening to this, think about what your choices might be when it comes to open enrollment. If you're younger, you might want to dial in your folks and say, hey, listen to the podcast, or, hey, how are you coming? Do you want me to go with you and sit down and talk to Ted and get some ideas on what the best way to do this is? Yeah. So we are passionate. We have the best job in the world in that we get to serve people. People think when they listen to the show, they think we're professional radio show guys.
No, they don't.
they
know that's not true.
We think Mike is.
Okay. No.
So we are not. We actually do. We have a day job and we do financial planning for a living. So we know a little bit about a lot of subjects. That's why we have an expert who knows a lot.
So you think on the surface this Medicare decision is a healthcare decision. No, it's a financial planning decision.
Absolutely.
You need to understand how it fits in your entire financial life. All right, let's go back to the big decision. Then we're going to talk about a couple of other scenarios. Big decision, you're 65. Do you go with traditional Medicare or Medicare Advantage? Traditional Medicare is A, B, D, and a supplement, or Medicare Advantage is basically just C, okay? What do you do? Talk about the drug component of each of those, Ted.
If you go with a Medicare supplement, A, B, and a supplement, and a D drug plan, so you've got A, and let's just clear this up just a little bit. A is hospital, B is doctors, C are Medicare Advantage, and D are drug plans. And so you choose a Medicare supplement with a drug plan. You have to spend some time and make sure you choose the right drug plan. I did one this week for a lady, and we put her drugs in specifically at Medicare.gov, and it was very inexpensive for the rest of the year, under $300 for the rest of the year. But I just showed her, we went on down to the bottom of the 24 drug companies that are available, and it was over 3,000 had she just picked that one.
You're kidding.
And so it's critical, very critical, and we have to do this every year. I'll tell you another short story in a second. But you have to go in and make sure we're getting the right drug plan for the drugs you take. Now, we can change that every year during open enrollment. I had another lady come in my office this week that hasn't changed anything. And she says, Ted, I didn't come see you last year in open enrollment because nothing changed. And she was correct. She did not change. She's taking the same prescriptions. Unfortunately, the drug company that she had changed and took one of her $480 a month drugs off their formulary.
You're kidding.
And she had a 90-day supply, so she didn't know that until April.
Oh, no.
And so in April, when she went to fill it, they wanted, she's been filling 90 days at a time, so they wanted like $1,500.
And it's too late to change.
We cannot change.
Because that open enrollment again, Ted, is what?
October 15th to December 7th each year.
You need to have a meeting with your certified financial planner where your health insurance decision is discussed and it's built into your budget and it's built into your retirement plan so we know it all works. Then you need to meet with your health insurance expert. Hopefully that health insurance expert is collaborating with your certified financial planner. And I say hope very loosely. They should be. They should be collaborating. But you're going to want to meet with your health insurance expert every year during open enrollment, right? And I know that makes you more busy, Ted.
No, every year.
You've got to sit down and say what's changed, and hopefully you're just shooting the breeze with Ted for 15 minutes because you're all set up. But what if something like that happened to you?
And I met with this lady, and she was on the edge of tears because it's brutal. And they had sent her a letter. She didn't think they had, but they had, and told her they were going to drop it. But she had 3 other drugs in her category they want her to try. Her doctor didn't really want her to try those because the one she has is working. But as a final wrap-up, he is going to try one of the other ones this week.
Okay.
I called the insurance company and said, "Look, what can you do for us?" And they had already done appeals and lost, and they said, "Yeah, there's nothing you can do."
Wow.
Yeah.
Wow. All right, so let's start talking about these couple other scenarios, and it's so deep. So hopefully you're tracking. But let's start skimming the surface of what if you retire before age 65? You're eligible for Medicare at age 65 unless you've been disabled or have the renal disease, right? So let's assume you're not eligible for Medicare until 65, but you retire at 62. What are your health insurance options? What do you do when you can't get on Medicare yet and are retired?
I really would have preferred you work till 63 and a half. But the number one option is Cobra. And everybody says, "Oh, I've heard about Cobra. It's so expensive." Remember this. You're buying at the average age of your employer group in most situations. And if you're in your 60s, you're on the top side of that average age by quite a bit. And so if the average age is 40, you're probably paying a 40 or 42-year-old premium. Mm-hmm. So when I go out to the marketplace and look for individual plans and compare them to Cobra, many times Cobra is the less expensive option, but almost always the better option because most of those are PPOs that will let you travel for care. We only have the 2 carriers left in the marketplace in Indiana, and neither one of those will let you go outside of the state of Indiana for care.
So Ted, again, in his very smooth talk, because he's a natural, he's an expert at this. He just kind of shared with you some really big stuff. All right, you have Cobra, could be an option for up to 18 months if your company offers it. That's why you said retire at 63 and a half. You can go Cobra right up until Medicare. But that's one option. Even if you retire at 62, you could take Cobra for 18 months. Then you'd have something to figure out. Or instead of Cobra, or you could go to the marketplace. And that's risky right now because there are a few companies. There's not a lot of flexibility, but you might be able to get some healthcare premium tax credits. And so you might be able to get a reduced payment if you've done some great planning and work with a wonderful financial planner. So there might be some options there. There's one other option as well that has its own risks to it, but more and more people, as health insurance costs are rising, more and more people are looking to that. We're going to tell you what that is, as well as talk about what your options are with health insurance if you retire after 65, coming up here on Wise Money with Korhorn Financial Group. All right. Okay. This is so good, and I'm so deep in it. That truly was the third segment, right? That wasn't the second?
Third segment.
Okay, good.
So
You're in the zone today.
I don't know. I'm just pumped up, and I think it's because of what Kevin you said. I've had this discussion more times in the last 2 weeks than any 2-week period in my career. More and more people are concerned and worried about this, who are either already on it and don't understand it, are about to get on it, or are looking at their retirement plan for the first time, saying, "How in the world do I plan for health insurance?"
I can tell you guys are excited about it because everybody's level after the first segment, you guys all
Are rising.
a little bit.
I can feel that.
So it's never too early to come in and discuss this.
Yeah, we need to say that. That's special content for you on YouTube. Come in and talk to Ted, talk to your health insurance
It
expert.
doesn't matter if you're 60, because you want to plan in advance.
right, so people say, okay, if I came and talked to Ted, what's the difference between Ted and the person at the front of the store at Walmart? Do they have the same options and choices and all that stuff? And what's the difference? So Ted, you would say,
I'm better than they are.
yeah. But
Experience, knowledge.
but is there a difference in products?
Not much.
Okay.
Not too much.
But it's about educating you so that you have, because to me, clarity is confidence. We talk about clarity and confidence all the time. You have clarity on what you need and how this stuff works, you will have more confidence. So when you're playing bridge or euchre with friends and they start talking about how their Medicare is only $25 a month, you can confidently say, well, we're on the traditional plan, so we pay a little more than that, but we're still in the right spot. You can say that with confidence.
Right, but I'm saying I've talked to folks and they say, well, I went and talked to this guy because he offers the AARP plan. Yeah. And so I think there's some confusion about if like for you, Ted, is there a difference between what you offer and someone else offers?
Not a definable difference. I might have this company or that company, and they might have a different company. So, but it all looks the same from the outside. Here's the bottom line difference. I don't know if it's on or not.
No, this is YouTube. This bonus content on YouTube.
Okay, is this? I had a guy in yesterday, one of the Bendix people, and he says, "Yeah, I know you guys. Oh, cha-ching, another sale." And I said, "Yeah, I hear what you're saying, but that's not the situation here." And we talked for a while, and we got to the end, and he goes, I get it now. Because he had bought from somebody else when they thought Honeywell was pulling their retirement plans last year. And the minute he talked to them, they signed him up. And I said, we're not signing up today.
Yeah, it's education.
Yeah.
It's explanation on here. And Ted needs to understand your situation and then share with you what your options are. It's not, hey, we've got this great offer for the next 90 minutes.
Yeah,
Sign
exactly.
Up. So, okay.
All right.
Fourth segment, land on the plane, and we'll pick it back up with
CHM.
If that's what yes, that's right.
We should say that.
Yes. All right. What's your Medicare strategy? Most people think, well, I'll sign up for Medicare when I'm eligible. No, you need to have a well thought out plan. That plan needs to be built into your retirement projection and built into your budget so you know exactly how it all fits and what your choices are. Oh my goodness, there's so much. We are glad you're with us. This is Wise Money with Korhorn Financial Group coming to you from the KFG studios at Korhorn Financial Group. My name is Mike Bernard. With me in the KFG studios, Kevin Korhorn and health insurance expert Ted Foster. If you've missed anything, let me just remind you, every episode's right there on YouTube. Go to the YouTube channel. It's Wise Money Radio. Just search that. You'll see every episode as well as this one. We've had people, as they're trying to understand Medicare, they will watch that a couple times over and over and hopefully kind of distill how, kind of make sense of it. Every episode's also on the podcast. You can find us, subscribe to it on iTunes and Google Play. You'll need to search Wise Money with Korhorn Financial Group online, wisemoneyradio.com, and call or text 574-222-2000. If you have any questions for the show or you have any questions personally, need to sit down and review this for your own situation, Ted's happy to help. We're happy to help. All right, we're talking about different scenarios and how you plan for health insurance in that case. We've switched to the scenario of you're not yet 65, you're not yet eligible for Medicare. What are your health insurance options? We like Cobra. If your company offers it, it will be expensive. So again, you need to build this into your budget, in your retirement plan. Second is you might be able to get a good plan, maybe, on Affordable Care Act on the marketplace. And those are could be especially beneficial if you get premium tax credits, do some great tax planning. There's a third option though too, Ted, right?
Yeah, there's several different Christian ministry associations that offer coverage at a very reasonable price. They're different. It's not health insurance. It's a group of Christians sharing their burden. They work very well.
They can work very well.
They can.
Mm-hmm.
You have to understand them. Some are more complicated than others, but they're not your typical health insurance. So you have to have a better handle on what it is, what it's going to do for me in my time from now till 65. Because remember, we're trying to bridge a gap here.
Yep.
Currently, this year we still have to pay penalties, so they avoid the penalty for not having coverage under the Obamacare.
This year we still have to pay penalties?
Yeah, still penalties this year.
For 2018.
Yeah.
Okay.
We believe that's over. We think this is the last one.
Okay.
Yeah. So,
but most of the Christian share plan they'll avoid the penalty.
Yes.
But I'm going to go back to what you said. It's really not health insurance.
Nope.
It's a group of Christians that have a shared belief. You even have to sign off on that belief, right?
Yes.
Yep. So be aware of that. And then say you have a claim.
Yeah.
Does your share plan pay all of it? Do you have to pay all of it, and then you're immediately 100% reimbursed? Or how does just very quickly
it's a good question.
The experience?
Each company has their own method, but I'll share one method with you that I'm very familiar with.
Yeah.
And that is that you are a private pay person as far as the doctor is concerned, and they bill you, you pay them, and wait 5 months for your money to come in.
Mm.
If it's a big claim, you would have to make a payment arrangement that would keep the doctor or the hospital happy until 5 months later when your money comes in, minus whatever deductible you chose on the plan you have.
Got it. So it's not just a very quick, seamless. You're going to have to likely cover for a while.
Yeah, you got to work on it.
Yeah, got it.
And can I do an HSA along with my CCM plan?
Not that I'm aware of.
Right. Which is also something we were talking about, just normal Medicare at 65. Yeah, no HSA then either. Mm-hmm. And that is very confusing. I had a very confusing situation with someone who got on Medicare a year and a half ago and said I made an HSA contribution to help with my taxes. And it was like, oh, no, you can't do that. Can't do that. So, okay, so your options, if you're retiring before 65, Cobra, a Affordable Care Act, or maybe a Christian share plan, that has to all be built in your retirement plan, your retirement projection. Can you retire before 65? The big question is health insurance, and this is why one of the reasons why I despise online calculators for retirement is those aren't options to build that in. Yet that could be several $1,000s a year of strain on your retirement, and for a lot of people it can work just fine, but you need to know. You need to have that clarity and know where that money's coming from. All right, now let's flip that script. You are working past 65. Say you're going to work until 68 or 70. What do you do with health insurance then?
Okay. So I'll make a couple assumptions. You're on a group health plan, and that's how you're getting your care.
Yep.
You're still working after 65, and it covers you and your spouse. You are probably an employer with more than 20 employees. If that's the case, you do not need to purchase Part B. Under 20, you probably will need to purchase Part B, just like you didn't have a group health plan.
Okay.
That's kind of the break off of who's primary, either Medicare or the group plan. And
Okay.
Up to 20, Medicare is primary, and after that, the group is primary. So it's just a difference. You still have you may, because your company may only offer an HSA. If you're in Medicare Part A, you can't make your contribution, as you just mentioned. But you need to look at this, and I will tell you, almost no one knows this or looks at this, and then they get penalized later. If you have most HSAs have a drug plan attached to them that is not, quote, creditable. If you are over 65 and do not have a creditable drug coverage, you need to buy one.
Whoa.
And hardly anybody knows that. And then they retire later, and they go, why am I getting penalized
For Part B.
for Part
Or
D,
D.
for my drug plan for the rest of my life? I was on a drug plan. So the employer is supposed to give you a letter once a year that says your drug plan is or is not creditable. Many employers don't do that. Some do, some don't. But you need to know that. So if you think you have a high deductible health plan, we need to find out if your drug plan is creditable while you're still on it, so you don't have that penalty come along later. And since you're not making HSA contributions, you can have a better drug plan to go along with your group plan
Interesting.
and have a good drug plan. So keep that in mind. Yeah.
So likely, if you still have group coverage and at an employer with more than 20 employees, you're likely, getting Part A, although you could opt out.
I was hoping you'd say that.
And then you'll stay on your group health plan until you retire and then slide over and make that big decision of traditional Medicare or Advantage. Talk about whether you should opt out of A if you're still working at 65.
In my opinion, if you have an HSA available, yes.
You should opt out so
Yeah.
that you can still make your HSA contribution.
Yep. You've got to understand that. You have to understand that because that takes a little effort. You got to get to the Social Security, and there's a form that you fill out, and you can opt out of A. They wouldn't let us do it for a few years. Then they came back and are allowing that again. So if any of your listeners are saying, "Wait a minute, I tried this a few years ago and I couldn't," that's back. So that's a good strategy.
Okay, so Kevin, quickly share the scenario we were talking about where the spouses are not the same age and what you do there.
Yeah, well, I mean, that is the big question is when he's 65 and she's 60 and they're ready to retire and they say, okay, so he's going on Medicare. What is she going to do? We know that, let's just assume that she was working, so she's got access to Cobra, so she can go from 60 to 61 and a half. My experience with Cobra, as you were saying, it's expensive. I've seen it's ridiculously expensive.
You know what? It's really not. It's just the company was paying for a big chunk of it,
Right.
And so your eyes are finally open to how much has the company been paying?
Well, so it's interesting because I've seen the scenario where he says, okay, well, I'm gonna draw my Social Security, and basically his whole check is going to pay for the Cobra piece. And so you have to do planning. You just have to plan.
In that scenario,
Yep. So actually, the scenario is just like the ones. It's a combination of the two we previously discussed.
That's right.
You're over 65. You go on Medicare. She's under. She either goes Cobra or she goes to ACA or a Christian ministry plan. ACA is Obamacare.
you need a financial plan. This needs to be built into your financial plan, and you need to have a health insurance expert working with you and your certified financial planner. And what I heard, you need to meet with that health insurance expert before 65, even if you're still planning on working after 65. You need to sit down with them and talk to them. What's the strategy here? Whew. That is all the time we have for today. If you missed anything, check out the YouTube channel. On behalf of Kevin Korhorn, myself, and special guest Ted Foster, we'll see you next weekend for Wise Money with Korhorn Financial Group.
Securities offered through Silver Oak Securities, member FINRA/SIPC. Advisory services offered through KFG Wealth Management, LLC. Doing business as Korhorn Financial Group. KFG Wealth Management, LLC and Silver Oak Securities Incorporated companies are unaffiliated.